If you have a crooked nose or a deviated septum, you may have already tried medications and you may have already seen a surgeon. Two surgeries that we generally offer patients are a septoplasty or a septorhinoplasty, which is also known as a nose job. My name is Dr. Camacho, and in this video, I will explain the difference between the two and how we as surgeons decide which one to perform. I have personally performed over 1,000 septoplasties and over 300 septorhinoplasties. In this patient, we can see that his nose is deviated or crooked on the outside. If you look on the inside, it is also deviated or crooked. This middle portion is called the septum, and on the sides, we have what are known as turbinates. There's worse deviations, such as shown here. This is what I would call an S-shaped septum, whereas the other one I showed before would be more of a reverse C-shaped septum and is less severe. In this case, I am showing the bone in blue and the cartilage in white. When we do a septoplasty, we can remove everything shown here in the striped area. We have to leave the front part of the nose alone, and this is the front part. We call it the L strut. This is cartilage. If we remove that during a septoplasty, then your nose would sag down. Generally speaking, if this area is involved in the deviation, then I will perform a septorhinoplasty. These turbinates, you have the superior turbinate, the middle turbinate, and the inferior turbinate. When we do surgery on the nose, we generally only operate on the inferior turbinate. If we are operating on the other two, then that's usually part of a sinus surgery, and that's different. Here's a side view of the turbinates, and you can see the inferior turbinate, the one that we operate on, is generally very large compared to the others, and the inferior turbinate is what we operate on to help nasal breathing. I generally will operate on the front section of the inferior turbinate, and to do that, we usually will make a small cut in the front, and we use what's called a microdebrider, which is kind of like liposuction, but for the turbinate. And by doing that, we're shrinking the tissue. When we're done, we push it out to the side or out fracture it to help improve the airway. We don't cut them out. Like if I were to cut out half of the inferior turbinate, I would worry the patient could get empty nose syndrome. Here we see a patient where the bones are deviated and the cartilage is deviated. The bone is shown in blue, the cartilage is shown in gray. In this case, a septorhinoplasty would be better because we need to straighten not just the cartilage, but also the bone. Additionally, I cannot straighten this cartilage from doing a septoplasty alone. You have to do a septorhinoplasty. Here we see a septorhinoplasty. The way we perform this is we make a cut on the bottom part of the nose. We can then lift by cutting inside the nose, exposing the cartilage, and we lift the tissue or the skin and soft tissue envelope up to about here. That allows us to see the bones and the cartilage. We separate the cartilage from each other. We can break the bones to put them back in the midline. Then, if needed, we can put these grafts. The blue ones are called spreader grafts. The green ones are called columellar or caudal septal grafts. And these purple ones here can go either superficial or deep to this lower lateral cartilage and allows the side walls to collapse less so the nostrils don't like sink in or close. Again, the main difference for me is if this L strut, the front part of the nose, is involved, I do a septorhinoplasty. If it's not involved and the deviation is in this area, then I will generally offer the patient a septoplasty alone. Each patient is different, so make sure to ask your surgeon what's right for you. This video is just for educational purposes. I am not your healthcare provider. Thanks for watching. Bye.